Okay, well, I think we've got a quorum, so why don't we get going?
Yes.
Welcome to everybody. I've been really looking forward to today's presentation, and unfortunately, I'm going to have to duck out early, so I'll watch the recording of it later. And let me encourage you to put yourself on mute. I'm hearing somebody's radio or something in the background, so if you would do that. Let me do two brief announcements and then turn it over to Nick and to David Main.
And I'll just say that I will put you on mute if I see that that's doing so, just because I can see who's making noise. I get little indicators for it. I apologize.
I said I was going to do two announcements. I'll actually do three. I found my World Series tickets from last year, and it just is a sad reminder of how quickly things can change. So let's enjoy the wonderful, good things that are happening in 2020 while we can, and we'll go on from there. First of all, a brief word about next month's program, the October program. We're going to do on technology that public health agencies are using to track and report on the coronavirus. Cindy Pangchi is going to be taking the lead on that, and we're very interested in finding people who would like to participate in that. Suniti and I are hoping to touch base early next week. So I would encourage you, if that's something that you have a particular interest in, if you know somebody with expertise in that arena and would be interested in participating, please reach out and let us know, and we'd love to talk with you. Second, I believe Joyce Hunter may have already posted, yes, Joyce, you posted the announcement about the upcoming blockchain event in the chat. So you have that, and I'd commend that to your attention. And with those couple of general announcements and a welcome, let me turn it over to Nick and to David.
I just have a couple of quick things to say. First of all, I see that Jessica Hale, hi Jessica, has joined us. I'm glad you did. Jessica is one of the two current Winston Fellows, and most of you know what the Winston Fellowship is all about. We've been pleased to have Winston Fellows attend our meetings in the past. And Jessica, correct me if I'm wrong, but I think you've just solidified your placement for your internship with the Office of Management and Budget. And so Jessica will be doing that. The challenge this year, of course, has been that the fellowships are virtual. We have one fellow who's currently working out of Atlanta, and Jessica's working out of Baltimore. But it's working pretty well. I mean, people on the Hill and people in the federal government are used to doing things virtually. So Jessica, welcome to Health Tech Net. And of course, knowing that you've been following the topic that we're going to be talking about, feel free to join in the discussion.
Thank you so much. I really appreciate the opportunity to join and listen in today. So excited for the discussion. Great.
Secondly, just on a housekeeping matter, one of our members told me, I guess it was yesterday, that they had received from me in my name an email. It was not from my regular address. But it said David Main on it. And I'm just wondering if anyone else has received that.
I did.
You did?
Yeah.
Hey, David,
I've had more than one from you, and they tend to be virus-laden pieces. But I say from you, it just says David Main, but it's never your real email address. I don't know why, but
I got one from I got one of those from Joe.
And I got one from Richard. I got one of those from Jim Oakes yesterday.
No, Jim Oakes,
as well.
I got mine from Jim Oakes too. Yeah.
And I got two from David.
Well, I've talked to our IT people, and we have not been hacked. I mean, our law firm has very good security safeguards, and so it didn't come out of the Health Tech Net database, which is housed at Nelson Mullins. But I think what they say happens is that somehow people get a hold of your name, or they might break into the recipient's email account and see that so-and-so, Doug or whoever, has gotten an email from David Main, and then they use that to send you one in one of the senders, the name of one of the senders who you communicate with. So I guess the lesson is for all of us, you know, of course, be careful if you receive something and it says open this up, double check to make sure that it's really from one of us.
Let me jump in there for a second, David. Just if any of you have questions about that kind of stuff, talk to me. That's what I do for a living, basically, is look at threat analysts and that kind of stuff. So I look at literally hundreds of thousands of those type of emails automatically every day, and you know, a handful, but happy to give insight. And I would agree with your IT. It's almost certainly going to be one of those emails we sent out where everybody was CC'd and they then jump in on that and kind of tell other people.
Well, rest assured that when as you probably have noticed, when I send out the Health TechNet evites, I put all of your names in the BCC category, so they should not be visible. And I think that we followed that rule for a long time. Okay, I'm going to lead the discussion or MC the discussion on the government affairs topic. But Nick,
can I
take a moment to?
Yeah, just let me reaffirm, as usual, the usual circumstances of muting, unmuting, chat, keep it professional. This is being recorded. Everything gets put in the cloud. I'll do some light editing. And if you have any questions, just because I'm on a slightly shakier connection than usual, I will have Joe as a backup because I don't want everybody to get kicked off if I get disconnected. So we're just working on that behind the scenes. That was it. I'll keep it light and looking forward to this. I was told to say specifically when I was talking about this with somebody else that it doesn't matter what the election outcome is supposed to be on November the 5th. You shouldn't plan on that because that won't be the day that the election is announced. But that was what I was told to say. Apparently that's going to be the case. So I'd love to hear commentary about that. I'm looking forward to this as well. So David, over to you.
Okay, thank you. Well, as we all know from just watching the evening news, we're having an election soon. And presidential election, of course, congressional and state elections. And so a number of us are following that for professional reasons as well as personal reasons. We put together a panel of 3 people who have long been known to us. And having said that, while we will give you some of our thoughts, we're hoping that everyone can participate in this because it's very inexact. The speakers are Deanne Kasim and Angela Evat from Change Healthcare. Deanne, as most of you know, focuses largely on federal issues for Change Healthcare, and Angela focuses on state issues in many states. And of course, in the healthcare field, what happens at the state level can be as important or more important in some cases than what happens at the federal level. Also joining us is my partner in the government relations group at Nelson Mullins, Jennifer Pharaoh, who worked on Capitol Hill and regularly communicates with and goes before members of Congress and their staffs. And so she's been following that pretty closely. The folks at Change Healthcare have been doing what we'd like to do today, and that is look at different scenarios. You know, what would it mean if President Trump is reelected? What would it mean if Joe Biden wins? What will it mean if Congress changes hands or if the Senate changes hands and it's all Democratic as opposed to being split? And in healthcare in particular, which issues will be most affected under those different scenarios? So a lot of people have been looking at this. And what we're going to do here, I believe, is have Deanne go first. And she's been collecting a lot of information at the federal level from different sources, including EHI and some other organizations that she regularly follows, like the Healthcare Leadership Council. And then Angela will tell us what's going on at the state level. Go back to Jennifer and her thoughts about what's happening in Congress. And all along, while we'd like to allow each of those speakers to have some portion of time, we're hoping this will be an active discussion as well. I may chime in at the end with a few thoughts of my own. So Deanne, thanks very much for joining us. Would you like to start us off?
Sure. Thank you, David. I have some slides that I thought about doing slides from scratch, and Dean Rosen, who many of you, I know Jessica, you probably know him from the Winston Fellowship Board. His team recently did a webinar with EHI, and I put the link in the chat for a deeper dive. Those of you who actually want to watch the YouTube webinar, look at the slides after the fact. But he did such a great job in terms of setting the table. I thought I would ask for permission to borrow their slides and just go from there. So Nick, is there a way I can get those slides pulled up?
You don't have them to be able to share?
I do, but yeah, I can share them, no worries.
Because I can share them, but it's easier if you control them. I just have them as a backup if you can't get to that. I've got to get to them.
Oh, good, it worked.
All right, webinar bingo, can you all see what I'm sharing?
Yes.
Okay, great. So I'm just going to run through this at a high level. Certainly Dean added a lot of color commentary, but this is just a way to level set. So, you know, as David mentioned, we're looking at—
Can I just interrupt for a second? Because I'm assuming that people are seeing the same as me. So there's like a top level summary thing at the, I don't know, that's taking up a lot of the screen. If you got rid of that, above that, there's a, no, so I'm seeing like, I guess tabs.
There's a bar across the top. I'm not quite sure how you get, let's see.
There's an X over there that you can get rid of that above there.
Deanne, I think you have to be the one.
There it is, that's it. Oh, not close all tabs. It's
Right, F11.
Actually, about right around the middle of the screen, there's the arrows pointing to the northeast and southwest. That button just below the URL in the middle of the screen. If you push on that, that should do it.
Thank you.
Thank you.
Technical issues. Thank you. I appreciate the help. So change in control of the House, the Senate, and the White House, as David mentioned, there's been a precedent for that. 2020, you're like any other, understatement of the year. So when we look at all the different disruptors, Dean calls these super disruptors, you know, here we have 4, which has never happened before in big election years, between the recession, the pandemic, mass protest, and is this an intense election? Sure, fair to say. Picture slide, yes, we're all dealing with unprecedented times. When we look at the perspective, I like this slide a lot. You know, here's the COVID response to date at 2.2 trillion and how that compares to other massive funding packages, whether it was the stimulus in 2009, TARP in 2008, you know, Hurricane Katrina, all the way back to Ebola in 2015 and H1N1. So as you can see, we're spending a lot of money. Where are we in the next COVID bill? Well, we're nowhere, quite honestly, in terms of a package moving or agreement on what that package might look like. But to sum it up, Democrats are looking at more state funding. They want more funding for testing. They want healthcare coverage, and they want more money in the pockets of the American people. The biggest factor of disagreement has been on the total size of the package. Actually, I have some notes where the HEROES Act, which passed the House in May, ended up being 3.4 trillion. And that has not moved anywhere in the Senate. The Senate recently passed their own skinny bill, as they called it, 650 billion. So as you can see, there's a wide disagreement on funding. Recently, the president has urged Senate Republicans to go bigger for a higher funding. There continues to be negotiations between Treasury Secretary Mnuchin, who is really the White House's designated negotiator, Chief of Staff Mark Meadows, Nancy Pelosi, As of right now, and I know Jennifer can comment on this as well, we have not seen anything move. The Republicans want liability protections. That's been something that Senator McConnell put out there as a line in the sand early and often. That is nowhere to be found in the Democrats' bill, really. Another round of stimulus checks. They totally disagree on the amount of funding that should be added for extra unemployment benefits, as well as how long that extra unemployment should last. They really want more temporary, limited, and targeted, as well as there's been presidential memos on unemployment insurance, payroll, student loans, and what to do about evictions. But as you can see, the HEROES Act was pretty comprehensive. The Senate bill was not. And looking forward to what will we expect from what Trump has done now, what could be the tea leaves for a second term. You know, we recently had an executive order last week that replaces a former executive order issued in July on drug pricing. The administration is really doubling down on an international pricing framework, which could be subject to legal challenges, you know, to be continued to be determined. They are looking at putting prices indirect to consumer ads. That's nothing new. Looking at reimportation from other countries, and things on the rebate rule. And I'll be honest with you, I am not, my big issues are not drug pricing, so I'm not doing a deep dive there. Value-based care, disruptive care. Today, CMS announced end-stage renal disease, mandatory bundles. And that's been something that now with Brad Smith at CMMI, for folks that are following value-based care, he's done a number of public speaking engagements recently, talking about all the models he plans to bring out towards the end of this year and into next. So he obviously hit the ground running. And for those of you that don't know Brad, he is actually from the Nashville healthcare community and is a protege of former Senate Majority Leader, Dr. Frist. So he's pretty well connected on the health policy front. Transparency, that's been another issue that this administration has put out there. Some of that has been contentious in terms of the CMS rules on what payers have to make public. We're waiting for that final rule to come out. That's actually sitting at OMB right now for final review. And of course, the provider rule that CMS came out with that mandates what hospitals have to make public on terms of their negotiated rates. The American Hospital Association sued and lost. They are now repealing that. But barring any appeal, that rule will go into effect January 1st. And telehealth, we'll get into telehealth in a little bit. There's lots of different legislative issues and regulatory issues about that. So repeal and replace. Repeal has been the GOP and this administration's rallying cry. Replace with what? Well, they're big on short-term plans, association health plans. They would like to have more flexibility in terms of your health savings accounts, your HRAs. I think it's very interesting that the Supreme Court chose the day after Election Day to hear arguments on the Texas versus Azar, which is the Supreme Court challenge on the ACA. Probably good timing not to have that before the election. And Trump has always said he will protect pre-existing conditions. Could he do that with an executive order? Something that you know, again, TBD. Could that be an October surprise? Never know. If one thing that we've learned, this administration can be pretty unpredictable. The price transparency orders I just mentioned, and then there was recently also in the CARES Act some changes to 42 CFR Part 2. For those of you that aren't familiar with that rule, that takes a lot of substance abuse disorder health record information and now treats it as part of HIPAA. Previously, that was governed by its own carve out, and that information to be shared for treatment purposes had to get patient written consent. That was actually a 1970s era rule that was never updated. And I'll just summarize the rest of this real quick. Implementing the 4 COVID response bills has been something that the president will, of course, use as a feather in his cap, if you will, and Buy American, Hire American. This is one of his campaign slogans, and one of his planks in his administration has been bringing back American jobs. So what might President Biden looked to emphasize? Well, he said repeatedly and continues to say, building on the Affordable Care Act, with a new public option to compete with private insurance. Some folks have said that's very much like what we had with the co-ops, just a different flavor and what happened there. But, you know, I think the one thing we've seen from this pandemic is that it has brought to bear all of the things that are wrong with the healthcare system, all of the things that are wrong with the public healthcare system, and all the things that are wrong with the growing number of uninsured, particularly with the economic fallout. So I think what I see anyway in policy circles and discussions is that the public option is getting some traction, is getting some consideration. And also he would commit to increasing the premium tax credit so that folks could afford a plan on the individual exchange. Biden too is also about lowering prescription drug costs, albeit a little different approach than what the Trump administration has said. He would allow Medicare to directly negotiate prices, and he would want to put some restrictions around drug manufacturers and how they do prices above inflation. Although given that we are in the middle of a pandemic and everyone's looking to pharma for innovation, for cures, for vaccines, it's interesting to see how such a tax would go through in that environment. Eliminating the tax break for ad spending, that's another thing to do with the tax code. And also he would look at drug importation from other countries, which is also an interesting argument that many in pharma are not in favor of at all. I think it's interesting that he mentioned surprise billing. That really has been the lightning rod issue. We've been going on for over a year now, and there's been bipartisan packages in Congress that did not move last year. It is not necessarily an issue that we think will move this year, even in a lame duck session. It's unfortunate, but I think at some point when we see folks that are still subject to surprise billing for COVID testing, and even though it's not a high percentage, I find it interesting that in this week's AHIP Medicaid conference, they actually took a general session and had an AHIP town hall and addressed this issue in terms of who's getting the surprise billing and why. Which then I think sort of conjures up some of the arguments between payers and providers and who's really in fault, but I digress on that issue. Access to healthcare, one of the key issues that I know my team is seeing and that others are seeing is the combination of the pandemic and social injustice and folks losing their job, losing their healthcare as well, has really brought to bear the idea of health equity, health inequity. Disparities in care. I mean, it's not just the underserved anymore. It's why is COVID affecting certain minority groups, certain demographics more? And is it because of the lack of healthcare? Is it because of genetics? Is it because of something else? What are we going to do about it? What are we going to do about just, you know, injustices in society overall? So this is something that I would look for a Biden administration to, number one, try to get us out of the pandemic, and number two, to really build on that, as well as mental health parity. I think we can all agree there's going to be a lot of mental health issues coming out of this crisis and continuing. A lot of that is unseen right now, but will definitely come to the surface. And then lastly, cancer moonshot. You know, this is a very personal issue for Vice President Biden, and I would expect to see more money allocated to address that at some point, maybe not necessarily while we're still trying to get out of COVID, but in the longer term. I think if you listen to this webinar, and I hope some of you that really want to do a deep dive, look it up. Dean and his teammate do a really good job of looking at what the messaging is going to be. And so when you look at what President Trump's been saying in his campaign message, you know, strong wartime leadership, save millions of lives. You can debate that all you want. And, you know, trillions of dollars, we're keeping the Democrats from spending recklessly. He's also doubling down on his criticism of certain governors who are unprepared, looking at mainstream media, another common theme. And now I think the latest theme that has evolved has been that impeachment was a huge distraction. If the Democrats had kept their eye on the ball, we would have had a better COVID response. And then, of course, he's also doubling down on the mail fraud and the Postal Service. And so, you know, you see that he's shifting blame a little bit and really looking at his candidate as, you know, I'm the superior choice. Joe Biden doesn't have either the wits or the leadership. We look at what, Biden's campaign, he's really doubling down on how this administration failed to lead in the COVID crisis. That's really their big, huge message. Trump is going to campaign on jobs and leadership and being tough on China, and that Biden will not be tough on China. And Biden's going to really bring about all of the things that didn't go right in the response to the pandemic and his past leadership with his vice presidency and all of the things that he and President Obama did to really address H1N1, Ebola, and of course, bringing about the ACA. This is a bit about the House and the Senate. I don't want to get too much in the weeds on this, but I will say that it would take a lot, let me just go back to the slide real quick, to flip the Senate. There's a consensus and a lot of discussions I've heard that is kind of a long shot. It's not entirely impossible. Check with us next week, let's see what we're saying then. But I think that it will be a challenge for Democrats to do that. However, there is a possibility where if Biden does run the table, the Senate could completely flip, and that would be an interesting situation where the Democrats would control both the House, which is really not anticipated to change party control, and the Senate.
Deanne, what do we know about the McConnell race? I haven't been following it myself, but how much trouble is he in?
I checked that yesterday, according to Politico, and he still has a pretty healthy lead. So that's not necessarily one of the races they're thinking is a toss-up.
Okay.
Hey, David, can I just say, I follow the 538 websites, and today they launched their forecasts for the individual Senate races, and they are currently giving McConnell a 96% chance of retaining a seat.
Right.
Can I ask a question? Because I'm a little bit of a baby when it comes to all this stuff. Has it ever been both the same Senate and Congress, Republican or Democrat? Has that ever been the case, or are they always flipped like this? So do you get?
Yeah, there have been times.
That has?
With both houses being the same party.
Being the same party.
Tell you exactly when those, Jennifer, maybe you have a better recollection, but it certainly historically has happened in a number of cases.
Okay, thanks.
Yeah, as far as the polls, I would say this, it's important to remember a few things. We thought we had 2016 figured out, and a lot of those polls were wrong. So we learned a lot of lessons there. And then also you have to remember that in many states, they're voting now. They're voting not just by mail, but also in person. And so one other thing I've heard is that the presidential debates that are coming up won't necessarily be as meaningful as they might have been, because a large number of voters are making up their mind now. They're mailing in those ballots. They're going to early in-person voting. And the decisions being made now as opposed to actually on election day. So that's something to keep in mind. The other thing to keep in mind is, as we said earlier when we started off the session, we may not have a decision for weeks after the actual election day itself on who is in the White House, or even some of the key Senate rates that might be hotly contested, or even in the House of Representatives as well, simply because there will be so many paper ballots that have to be counted. So that's a little anticlimactic, I know, but that's something to keep in the back of your mind.
Yeah. So Deanne, just this morning I heard on the radio that this is the first time they have the lowest percentage of voters to say that debate is going to make any difference. It's like 26% of the people said that debate might make any difference. And as far as I was recently listening to something and they said it may be, hopefully it's end of November before we know who was going to be in the White House, but don't be surprised if it goes into December because of the mail-in ballots and all that stuff.
Right.
I had also heard that Pennsylvania will not start to even count the mail-in ballots until Election Day, whereas other states do it on a rolling basis.
Right.
So if there's a large amount of mail-in ballots in Pennsylvania, you're not going to have any numbers one way or the other.
Right. Right, you're absolutely right, and which is a huge swing state, which would be interesting. But I've heard in some other discussions, you know, political sources and policy wonks have said they're predicting up to possibly 6 states where there might be legal challenges to either voter fraud or whatever the case might be. And I really sincerely hope personally that that's not the case. Some of us might remember what happened in 2000 in Florida and the hanging chads and how that just dragged on and on and on. And I don't know if this country can take something that takes several months to figure out, but you know, this is a new year. It's unprecedented is I think the word I keep coming back to this year. So looking ahead in terms of, we already covered this, but this is a nice summary slide that Dean put together. You know, where does the GOP stand between repeal and replace, and the Democrats are, you know, Medicare for all, I think is not necessarily getting the volume that many of us thought it would get this year because of the pandemic. It's certainly not going away. And I think Vice President Biden, should he win the election, will have to temper that progressive side of the party with, it's interesting to me that, you know, I've seen Speaker Pelosi's very well-known, very educated, very smart, longtime policy advisor. I know, David, you know him, and but Wendell Primus has been working for the speaker for a long time, and he's her go-to on economy and healthcare. And he presented to the Healthcare Leadership Council Policy Committee last year. And I had the privilege of hearing him go through his presentation of why Medicare for all is unaffordable. And this was, you know, a year ago before we're even dealing with COVID. And it's just a very thoughtful presentation, in my opinion, because he looks at all the things that are going to affect the government's bottom line. But I think the interesting thing is you've got, you know, a senior leadership in Pelosi, and you've got the younger, more progressive side of the Democratic Party in the House, and where is that all going to end up? Deficit concerns will resurface, absolutely. Will that put downward pressure on health costs? Well, that'll be an interesting thing to see, because Medicare and Medicaid are going to have absolutely no room for increasing reimbursement, and in some cases may have to decrease it, particularly on the Medicaid side. So what does that do to private sector healthcare costs? The public may be more accepting of a broader government role, or they might be more skeptical, and also more oversight. I think with the whole price cost transparency situation and discussion and the rules that came out, and I know Angela can speak to this on the state sides, you know, who's charging what, who got reimbursed for what, and what is at the ultimate end of the day, what is the patient or health plan member paying and why? So Dean expects more oversight there, and I would agree with that. Definitely on the telehealth side, there's a number of bills floating around right now. The most popular was HR 7663. We supported it as Change Healthcare. Over 250 other organizations supported it. We want to see a lot of those restrictions be lifted and become permanent. The idea of whether or not reimbursement for telehealth should be the same as in person is coming to be an interesting discussion. I don't know that we could afford that, but that's something that Senate and House has been discussing. Licensure, just FYI, that's, you know, can practitioners practice across state lines? That is a state right to make those decisions. However, we've already seen work in Congress to try to incentivize states to make that decision and make that more flexible sooner rather than later. I won't read all of this. You guys can definitely read the slides, but you know, there's a lot of decisions, as you can see. Public health funding being a huge one that we've spent a lot of time discussing here in our team. All of that needs to be addressed by not only whoever runs the White House, the administration, but also by Congress. And how does the American people view the crisis? You know, how are we viewing now our doctors and hospitals? What do we think about drug manufacturers? How do we view labs? And what do people think about insurers? Insurers are sitting on quite a bit of money right now, with folks foregoing elective, foregoing a lot of care, foregoing preventive care, which is not good. But you know, where are they going to come out in this whole conversation in terms of public perception? So I'll stop sharing my slides, and I don't know, David, if you wanted to stop for questions or turn it over to Angela to discuss the state issues.
I'll make a couple of comments and then turn it over to Angela for the state issues. Medicare for all. I've been thinking about this, and you think about Medicare for all as being similar to what Hillary Clinton once proposed, like national health insurance or whatever. But if you look at Medicare, one thing that is becoming more and more popular, of course, are Medicare Advantage plans. And I can envision a form of Medicare for all that is not really government run. The way Medicare Advantage works is a number of coordinated care plans can make themselves available in certain markets, and a Medicare beneficiary would opts out of traditional Medicare and signs up essentially with an HMO or a PPO plan that is privately run. And those plans are given star ratings by CMS, and there are penalties if the star ratings drop. It's very popular. It's increasing in enrollment every single year, and that might be a form of Medicare for all that would be both private sector oriented and yet involve Medicare regulation. So that might be something to keep your eye on. Another thing I was going to point out is that just like all of us, I have investment advisors and have talked to them about what the election might mean to Wall Street. And most of us have been following this, but apparently, despite political inclinations of individual people, the market in general would be concerned about a Biden victory because they would worry about increased taxation of the private sector, maybe an increase in financial regulations, a la what Elizabeth Warren has favored. Not that she would be the decision maker necessarily, but certainly there's a wing of the Democratic Party that believes that the more regulation of the financial sector is necessary. Overall, if you're wondering what would happen to your 401k plans and so forth, most likely a Biden victory would be less favorable in the eyes of Wall Street. I'm not taking a side on that. I'm simply reporting that seems to be the observation. I was sent by my advisors this kind of a presentation by Wells Fargo where they looked at different scenarios and would be happy to make that available. So a couple of comments there.
David, I heard a counter argument to that one, which was the historical performance. When you look at if you go back sort of the last 30 or 40 years, the stock market has performed better under Democrats than under Republicans, and the deficit has also been better under Democrats than Republicans. And so one of my friends who is a financial advisor was suggesting that although in the short term there might be a dip, in the longer term, that the numbers suggest that a Democrat in the White House would result in a better performance overall over time.
Interesting. And then I guess that's historically true. And of course, you have to look at which stocks you're talking about. Obviously, as a result of the pandemic, tech stocks have done really, really well.
Yeah,
airline and tourism have not done so well. So you have to pick which stocks you're talking about.
This was not stock specific. This was looking at the indexes.
Yeah, not just the market, but okay. Well, why don't we switch over to the state side? Angela, you might give us some insights on what's happening there.
Sure. Can you guys hear me?
We can hear you just fine.
Awesome. So on the state side, I'm going to start with the governor's elections. As you guys know, the COVID response has definitely put a spotlight on governors. Some governors' responses have sort of increased their popularity, while other governors have sort of decreased their popularity. But we're looking at 11 states having gubernatorial elections. Right now, we have 26 Republican governors and 24 Democrat governors. At least 9 of the states are having incumbents seeking re-elections, and 6 of these states are currently labeled as safe for one party. But there are a few that are going to be quite competitive. I'm going to highlight a couple of these. The most competitive one that we're seeing is probably the governor's race in Montana. The current Democrat governor Bullock is out because of his term limits, and by the way, he's running for U.S. Senate. But we have a race between Lieutenant Governor Mike Cooney and will face Congressman Greg Gianforte. Gianforte is a technology entrepreneur, and this is his second try at the governor's race. He lost in 2016 against Bullock. His campaign is running on economic growth and high wage jobs in Montana. And Cooney has focused on healthcare and agricultural in his campaign. While, you know, Montana sort of leans Republican, Montana has had backed Democrat at the governor's side for at least 4 gubernatorial elections. So that's one that will potentially be pretty close. The other one that we're watching is North Carolina. And North Carolina all over is sort of a hot state right now. The Democratic Governor Cooney is facing former Republican Lieutenant Governor Forrest. North Carolina had the closest gubernatorial election in 2016, where Cooper won just by 0.2 percentage points. And North Carolina is slightly leaning Republican, and Cooper, as the incumbent, will probably face a close race. Forrest has been a pretty outspoken opponent of Cooper's reopening approach, and even has filed suit against Cooper in June, but that was overturned. Recent polls put Cooper leading about 11 points among registered voters. And one thing on the health side for North Carolina, as you might know, North Carolina is not a Medicaid expansion state, but Cooper has supported Medicaid expansion, but has faced opposition with Republican legislators that he wasn't able to move that forward. But we'll talk just a little bit about the legislative side for North Carolina in just a minute. So, and there are a couple other states, but those are the 2 ones that have been sort of the closest. On the state legislative side, we have 44 states holding legislative elections. The Cook report has identified 18 chambers as competitive. We have Republicans holding 13 of those vulnerable chambers on that list, where Democrats are only holding 5. So Republicans are really playing defense in 9 Republican-held chambers. And for example, this includes the Florida Senate, Georgia on both sides of the chamber, Iowa, North Carolina as well, Pennsylvania on both sides of the chamber. What Democrats are playing defense in just 3 chambers. This is the Maine Senate, Minnesota House, and New Hampshire House. On the toss-up side, Republicans are controlling 4 of the chambers that are toss-ups. Examples include Arizona Senate and House, and Michigan House, and Minnesota. And then while Democrats only control 2 chambers that are toss-ups, Alaska House and New Hampshire Senate. So some of the states that are going to be interesting come November is Arizona. And all the states that I'm going to mention are going to be swing states in the presidential election. So that'll be interesting. For Arizona, the Democrat Party only needs 2 seats to flip the House and 3 to flip the Senate. So it's going to be close. And the environment for the Dems was strong in 2018, where they were very close to forcing a 30-30 split in the House. The last time, though, the Democrats controlled the House in Arizona was 66. So it'll be interesting in Arizona. On Pennsylvania is another one on both the Senate and House side. The Democrats need 9 seats to flip the House and 4 to flip the Senate. As you know, Biden is from Pennsylvania, and he maintains leads in Pennsylvania right now that could help the Dems down ticket. But one caveat, and we talked a little bit about mail-in ballots and some of the sticking points around that, and a lot of states are facing lawsuits and problems with those, and Pennsylvania is one of them. The state is facing delays. They haven't been able to mail out their ballots just yet because of a decision being tied up in courts. And there's quite a few cases right now that are tying up some of the state elections. So getting back to North Carolina, and on the legislative side, the Democrats can potentially flip the Senate, which is easier of the two. They would need 2 of the 6 seats currently leaning Republican. And to flip the House, they would need to focus on 5 of the 12 leaning Republican sides. It's a pretty competitive race this year in North Carolina. We have the U.S. Senate races, we have the governor's races, and so North Carolina is going to be a pretty strong focus. So as it relates to Medicaid, there could be some potential changes on the Medicaid expansion side in North Carolina come the end of this election if things sort of change in favor of the Democrat side. One thing to keep in mind also for this election cycle, this is the last cycle before the redistricting, because we have the 2020 census, and things could certainly change after this election with regard to where sort of the maps play out and come the next election in 2 years. So those are the highlights on the state end. As it relates to responses to COVID, states are certainly focusing on similar things that the feds were focusing on that Deanne mentioned. Lots on the telehealth front. We're seeing significant numbers of executive orders waiving requirements to allow for telehealth, and even states now are making some of those requirements permanent. There were a few handful of states that passed requirement flexibilities in 19 that was going to, or in 20 that was going to be impacted or implemented in 2021, and they're moving that further or closer so that that could happen. So states are really looking at telehealth. States who had state-based exchanges, open those up to respond to the need for insurance coverage. We had a number of states have special enrollment sessions during April and May and June, and some have even has extended that through the end of the year to continue those open enrollments. But states are focused on budgets as well. There's significant budget shortfalls for states, as you can imagine, which I think we'll see a lot more significant impact play out as states consider their budgets in October and November and through the next year for their next fiscal year. Where states did make some cuts to this year's fiscal budget, I think we'll see significant more in the coming year.
Angela, could you talk a little bit about privacy legislation and what's going on at the state level as well on that issue?
Sure. So we saw a lot of legislation in 2019 around data privacy, and these are bills that were addressing data privacy as it relates to usually online data, things that look similar to the California Privacy Act or CCPA. And some of those bills, or most of those bills sort of fizzled out. In 2020, there was some introductions early on, but as states focused on COVID, a lot of that attention sort of was shifted to the response. However, we did see the changes in California, where CCPA was in effect or went into effect in January, but there were continued to be opportunities to seek to amend California's law. And we saw laws related to privacy around genetic testing move forward, as well as exclusions around using certain data for research and identified data move forward. There is going to be a ballot initiative that will seek to completely amend CCPA and make it part of the Constitution. That's getting strong sort of attention from either supporters or those who aren't supporting it, and has made some interesting partnerships where ACLU is partnering with some of the tech folks that are both opposing it. And there is some support from other areas where they want that initiative to go forward. We have also seen, as you might have remembered, in Washington State over the last 2 years, they tried to move forward a privacy bill, but failed the last 2 years. There's recently been a draft released of what they'll plan on taking a look at for the 2021 session. It looks very similar to the last year's bill with a few tweaks. The sticking point for last year was on the enforcement, whether or not there should be a private right of action or if there should be GA enforcement. And that sort of led to its failure. I looked at the enforcement provisions, and they don't have a private right of action, but there hasn't been any sort of tweaks to it to make a compromise between the two sides. So it'll be interesting to see where that ends up. And then Texas had a work group going over the interim session, but they weren't able to meet due to COVID. They did release some high-level recommendations, so it'll be interesting to see how those play out in their 21 session.
Interesting. Well, thank you. Anybody have any observations or questions about the state level?
Well, I would just point out what I wrote in the chat, just that in my business and what we're seeing, we do quite a bit of work for state and local governments, seeing absolutely just horrendous budget impacts. I would recommend people keep an eye on the sales tax revenues. Places are seeing very large numbers. West Virginia, for example, is pulling that stuff back. Counties pulling RFPs, which I've never seen in my entire life. I think Fairfax County is cutting something like $1 billion off its budget. DC, just the convention center, the numbers they released about a month ago, they were down $472 million in revenue. So these type of numbers are just gargantuan. And New Jersey, I think, announced a couple of days ago, it might have been a different state, so excuse me if I'm wrong, but they're going to be doing furloughs, including with the governor's office. So like people just literally taking off with no pay for a week.
Yeah, and I think
like
that was New York.
I think it was New York, New Jersey, I think, but those kind of things. I think, New Jersey is the one that said if they don't get money, they're going to have to start furloughing massive amounts of state employees as well. So I think 2021 is not shaping up to be a very good year for most state and local governments.
Yeah, and the states have lobbied the feds for additional funding through packages, but and we know that's not happening. I think they were holding out hope that they would get additional funding on the federal side, but are going to have to really take a close look at their budget come this October and November.
Yeah, I think it was even Bill Barr that came out and said, as the Attorney General, that he'd like to see some of the states go bankrupt, which hitherto now has been sacrosanct and impossible. And on top of that, one of the things most people don't realize is that most state and local governments aren't allowed to go into debt. They have to have a balanced budget. Now they can issue bonds to balance that budget, but they don't have the ability like the feds to just, print $5.2 trillion and, increase the deficits, et cetera.
I'd like to ask a question, David, if I may.
Sure.
Since we have Angela and Deanne on the line, both at the same time, I'm a little confused about the whole telehealth and the crossing state lines issue. I hear, you know, CMS waived it, but it's a state issue. And so where, A, what's really the deal with that? And B, what's your crystal ball say of where that's going to go in the future? Because I think that's an important, in addition to the parity with reimbursement, which I'm not sure is going to stay, but the state line issue, either on a national or a regional level, you know, like I can be a physician that in my surrounding 3 states, I can cross it. I mean, what are your guys' thoughts on that?
Well, I'll give you the federal perspective, and then Angela, you can comment on the state perspective. So earlier in the crisis, we actually had a piece of legislation that the Healthcare Leadership Council actually worked on preparing that would, you know, mandate that states could license one doc or clinician, and that clinician could practice using telehealth and the other. And at the last minute, they had to pull the bill because they were told by legal that that's unconstitutional. States reserve that right to license clinicians and to make whatever those clinicians can or can't do with that licensure, and for the federal government to come in and pass a piece of legislation that would usurp that is unconstitutional. That said, on the federal side, states are now asking, there are other people asking Congress to help incentivize the states. You could do that a number of different ways, possibly with appropriations, like if you guys do this, we'll give you some money, yay, everyone's a winner. But, you know, TBD on how that might work with the Fed sweetening the pot, but it's really up to the states. And, you know, I know we've seen some states already make some decisions there. So, you know, Angela, I'll throw it back to you.
Yeah, so in thinking about telehealth, it across state lines, again, the state licensing boards make the rules in terms of who can practice telemedicine, can even put some requirements on the practice of telemedicine for the particular provider types. There are some states through executive orders that have waived or sort of softened requirements around licensure. So they might say if you have a license in good standing within certain states, they might even identify those, or nationally, then the license is accepted within the state of X or Y to practice telemedicine. There are some states that are looking at potentially making that permanent, but I think most of the states are focusing more on the provider types and the location type flexibilities within their state in terms of making those flexibilities more permanent. There is and even before COVID, there is a national licensure compact that some states have signed on to make it easier for different provider types to more easily get licensed in states. That doesn't sort of eliminate the state's role to oversee that license and sort of do their own due diligence, but it makes things easier if they're already licensed within a state that is part of that compact. And if folks are interested about sort of who those states are and what that looks like, I'm happy to send that information. But it's definitely a challenge if physicians are looking to provide services across state lines. And then even in some states, you have to be licensed in both locations. So say I'm in Maryland and I'm looking at providing services to a patient in Vermont, there could be some states that say you must be licensed in both locations.
The compacts thing you're talking about is the nurse's licensure, right?
There's a physician's one and there's a nurse's one.
Oh, there's a physician one?
Mm-hmm.
Okay, cool. Thank you.
Yeah. Yeah.
It's still going to be patchwork for a while, but there's no doubt that the pandemic has shifted the momentum dramatically in favor of facilitating telehealth. People just need it. And the other side of that is the payers are reimbursing it now much more easily. So any other thoughts on state for the moment? Okay, well, Jennifer, why don't you give us whatever observations you might want to add based on your experience with Congress, day in and day out.
And this is just, my comments are just additive because Deanne and Angela have pretty much covered the landscape. but just to give you a snapshot as to what's going on in Congress now, they basically have maybe 2 priorities to try and get done before they leave for the election. The first, of course, is the COVID-4 package that Deanne described, and they still are, just to underscore, far apart. I think they're about $1 trillion still apart. There were some sort of little signals out there, if you will, from Speaker Pelosi that she wanted to again try and restart the negotiations with Mnuchin, the Treasury Secretary, but that hasn't gone very far yet. But what is sort of significant, at least politically, is that it seems like the Chief of Staff, Mark Meadows, has now been sidelined, and he's, you know, his background in Congress, he's sort of a Tea Partier, and he was not very much cooperating as far as coming up with a package during the last go round. So that will, they've got a few more weeks, but again, no one's real optimistic that it will actually happen before the election. On the, just so you know, their Congress expected to be in session, probably the House, maybe through the end of September. The Senate, they're making noises about leaving by the end of next week because Mr. McConnell's very concerned about a re-election of several of the Republican senators who are in tough races, as you know, described by Deanne. So that's, you know, basically where things are in that. One other must-do item, however, is the budget. You know, everyone knows that the fiscal year ends September 30th. So appropriations not going to get done, as everyone might expect. So they'll need a continuing resolution, and this is a must-do item before they leave. Right now, there's negotiations going on as to how long the continuing resolution will be, and whether or not it's what you call it a clean bill, where there isn't anything added to it outside of just keeping the government running, or if they'll actually add certain items to it. As far as timing for, as we all, everyone here knows called a CR. As far as timing for the CR, how long is it going to last? That's the big question of the day. Mr. Shelby, the chairman of Senate Appropriations, has indicated that he would like it to run just until after the election, sometime early December, so that Congress has to come back. House Democrats are inclined to have it run through probably January, you know, up until the time of the president's inauguration. Because, and this hasn't been expressed explicitly, but sort of implied to me when talking to leadership folks, there is some concern about whether or not the current president, if he does not get reelected, whether or not he would actually sign a CR, another continuing resolution, say early December, or if he would veto it and therefore shut down the government, because there's just so much uncertainty on his actions at some time. So that is one of the reasons why they're trying to push it to the end of January, just to make sure that the government stays open at that point. Couple things I would just kind of add to Deanne's presentation. You know, additional maybe items next year to put for Congress to consider. High-tech reauthorization is up next year. And it's interesting because, you know, the original champion of that was Senator Kennedy, and obviously he's not around. it's going to be a whole new cast of characters who are going to be considering the parameters of high tech and how it should be reauthorized. And I don't know if there's been any single person to emerge as a techie, there. It is interesting to note too that the Senate Health Committee, which has authorization over high tech, will have a new leader. Senator Alexander, current chairman, is retiring. And so I went down the list of potential Republicans, and you have to drop down a little bit down in seniority due to retirements and maybe a senator chairing a different committee. It might be a more plum assignment. And it looks like the two main contenders are, well, they're both healthcare providers. Rand Paul of Kentucky, or Senator Cassidy of Louisiana, who's remind me, Deanne, I think is he a gastroenterologist? I know.
I can't remember, but that sounds about right.
Yeah. So it would be very interesting to see, how that plays out. Now, if the Senate does flip to the Democrats, it would likely be Patty Murray, who is the current ranking member on the committee. So you'll have a whole new cast of characters involved in the healthcare arena next year on the Senate side. On the House side, things are expected pretty much to be status quo. With regard, I think most people assume that the House will remain Democratic. Speaker Pelosi has not made any sort of given any sort of signals that she plans on leaving her post. But what you will probably see next year, or at least among the Democratic leadership, you'll see some people jockeying to be the heir apparent to be speaker maybe 2 years from now. Trying to think, I'm having a look at my cheat sheet here of items. I think that is pretty much it. I'm happy to field any questions. Just for background, I am a veteran also of a presidential campaign. It was a losing presidential campaign. So if you have any questions about the political realm as well, I'm happy to field those.
Jennifer, it looks like, just sort of to get down to basics here, and to sum up, if Biden wins and becomes president, and the trends that we've been discussing, come true, we'd still have a divided Congress, and Mitch McConnell would be the majority leader in the Senate. Do you think there's, just sort of reading tea leaves, would he just stop everything in terms of the Democratic initiatives, Medicare for all, or expanding the Affordable Care Act? Or do you think that there's any possibility that he would be more inclined to be cooperative if Trump is in his second term? I'm sorry, if Trump is gone under that scenario, and Joe Biden maybe having some more congressional skills or interest than the current president does? Do you think that he might be able to work with McConnell? Or do you think everything's going to pretty much stay the way it is between the Senate and the House and the White House?
Well, maybe I'm being overly optimistic, but if it is McConnell Biden, they were colleagues and in the Senate. And, when you boil it down, Joe Biden is a legislator, okay? And he has worked well across the aisle in the past. So I think maybe the tone would change in that way. And Biden is not one necessarily to promote radical, initiatives, things along that line. I think his main emphasis when he probably gets in on healthcare, at least, will be to undo what has been done during the Trump administration, as far as, maybe restoring some of the, provisions of ACA and maybe finding ways of strengthening it. So I think there would be cooperation. You also, too, McConnell, things in the Senate operate by unanimous consent in a lot of ways, so he will have to reach across the aisle. And I think that even if McConnell holds on, the Republicans hold on, there will probably be less of them at the end of the day. It's going to be a narrower majority that they have, which will force more cooperation, I think.
One thing that, and I worked for the Senate Health Subcommittee a number of years ago, and I've always been impressed with the fact that the people who are on Capitol Hill, whether they're members or staffs or committees, always have a trove of issues that that need to be worked on, and they're not necessarily the sexy political issues. Sometimes they're fairly detailed types of things having to do with privacy or having to do with Medicare, Medicaid reimbursement, that sort of thing, and they have those at the ready. Senators and members like Alexander have been very important in keeping those things moving. Alexander, correct me if I'm wrong, had a pretty good relationship with McConnell and has been able to move legislation through the Health Committee. And so the fact that Alexander is leaving is going to have an impact, certainly on the Senate side, right? And on the House side, I don't know how much trouble Neil is in, the head of the Ways and Means Committee, but what do you think, Jennifer? Is legislation going to keep moving? I'm talking about garden variety healthcare legislation, as opposed to the really big ticket item like the Affordable Care Act.
Well, if Biden is president, I think more things will get done because you don't have anybody in the White House who's sort of stirring the pot as much. You will have the whole tone, I think, will be different. There won't be as many tweets, which I find kind of entertaining every day, but I think there will be more of an emphasis on, doing some problem solving as well, and probably looking at things where, of course, it's bipartisan and you can actually get things done. I mean, one of those items, and Deanne chime in on this one, I think that will come to the forefront is public health, and in a couple of ways, public health, information, technology, the infrastructure. I mean, COVID really unmasked how that needs to be modernized. People need that information. They need it now. It's more important than ever. So I think that is going to be an important issue next year. There is a provision in the HEROES Act on public health infrastructure that is actually pretty good, I think, pretty well thought out in a lot of respects. It does call for public-private cooperation. It also pulls in the Office of the National Coordinator, because we know those standards are so important that they be consistent across regions reporting standards. So I think that is probably one area that you might see next year if for some reason it doesn't get done this year.
Yeah, I would agree with that. And that's actually, as you know, Jennifer, an area we've been spending a lot of time talking to legislators. And really, it's interesting to me that the Healthcare Leadership Council, which is really, for those of you that don't know the organization, is made up of 50 healthcare companies from all over the industry: bio, pharma, payers, providers, device, senior helpers as a member. So it's a very diverse group, and they started this task force over a year ago to look at how we could do a better job, public and private partnerships for disasters, and that could be any kind of disaster. And so now, of course, we've really focused on the pandemic, and it's interesting to see all these different CEOs come together with all the different facets, whether it be supply chain, whether it be like access to PPE. And the CEO of Premier, Susan DeVore, is saying still how hard it is to get enough PPE for their hospitals, which is really kind of scary when you think about it. But one of the areas that we're putting together a roadmap for is public health infrastructure, and how we could use the existing infrastructure that we spent so much time, money, and effort to build, like the existing HIEs, Commonwealth Care Quality, the VA's HIE, and how could we leverage that for public health data and information exchange. There actually is a roadmap put together for that Duke Margolis put out there. But it just seems like such a no-brainer to try to leverage what we have and use that for public health. So we're hopeful that'll actually get some traction.
Any other comments or questions at this point? Hearing none, I thought I would share one story that's actually, I think, kind of a positive story about the virus, believe it or not. There's, as many of you might know, there's a town in Colorado called Grand Junction. Grand Junction, if you look at the state, is on the other side of the mountains from Denver. It's got about 65,000 people. Its history is as a mining town. It also, pretty much no longer is, but people who live there just love Colorado and enjoy being there. It has a pretty good healthcare industry, a couple of hospitals, and it has had one of the longest running HMOs in the country, Rocky Mountain Health Plans, which was for years a nonprofit health plan, and actually had as members almost 90% of the lives in the in Grand Junction and in Mesa County. So it was a very good coordinated. It is a very good coordinated care system. A couple of years ago, United purchased it, so it's part of the United system now. But it didn't change much in terms of its community mission. The CEO is a guy named Steve Erkenbrecht, who some of you might know. He was on the AHIP board for a while, and he actually was a lawyer by training, but he finally decided to retire. And when he did, and they looked at what's going on with the coronavirus in their town, they are facing the usual problems. How do you deal with getting people to wear masks? And how do you have good, public health habits and so forth? And so Steve and some of his legal colleagues basically said, we think we should blame the lawyers. In other words, lawyers got together and they basically said to the restaurants and other businesses, retail businesses, they said, if you don't follow the right procedures, you could get sued. And if somebody dies as a result of the fact that you're not following the proper procedures, you not only could be sued, but you could lose your entire business. And the lawyers actually put something like that out, not threatening to sue anybody, but really trying to alert people to the liability risks of this. And it got people's attention. And then the next step, and here's the good part, is that they realized that the hostesses in these restaurants, for example, or the people working behind the counters in retail stores might be making minimum wage, and they can't put them in the position of telling somebody who comes in the store, you can't come in because you're not wearing a mask, or you've got to behave in a certain way. It just wasn't, that just wasn't viable. And so the health plan got together with the Chamber of Commerce, and basically they said, why don't we come up with a star rating system? And they also got the State Department of Health involved, and they said, okay, we're going to make this into a positive experience. If you follow the right procedures and get people to wear masks and do the other things in terms of cleaning properly, we will give you a star rating, kind of like the Medicare Advantage star rating, from 0 to 5. And at first, everybody was somewhat offended by this whole idea. But then what people found is that instead of people leaving the establishments because they, and not patronizing them because they didn't have proper health habits, people were actually being attracted to the organizations that had higher star ratings. They had several organizations step forward right away and said, okay, come on and look at our organization, county health department, and give us a star rating. And those establishments that had 4 and 5 stars, all of a sudden were getting most of the customers. And now in Grand Junction, everybody's jumping on the bandwagon, and or at least most people are, and they're calling the county health department, they're calling the Chamber of Commerce and saying, how do we get a star rating? Because and it's creating an incentive for everyone to follow proper healthcare habits. If you want to look at this, you can Google Mesa County, and you look at the Mesa County website or the Chamber of Commerce for Grand Junction, you'll see a description of this program. I actually mentioned it to some of the commissioners in Dewey Beach, where I have a home, and they want to do it here in Dewey Beach, have the Chamber of Commerce and the Sussex County Health Department institute that kind of a system. So I thought that was kind of an interesting turn of events. We'll see if it catches on. In other words, making it a positive incentive situation rather than a threatening situation in terms of wearing masks and so forth, which, as we know, our Attorney General has likened to slavery. But I'll put that aside for now. But I do think that I guess another maybe closing thought is that there are an awful lot of problems right now in terms of making plans for 2021. And I'm associated with a couple of organizations that do meetings or do social gatherings, the American Hospital Association, the pharmaceutical industry, the American Medical Association, Health Management Academy. These are organizations that have meetings every year. And I think people have been hoping that the pandemic would end at a certain point. But if you want to have a meeting, you have to sign a contract with a hotel or some sort of a host. And those contracts usually require a deposit, often of $20,000 to $30,000. And you end up canceling the event, you have to pay a penalty. That's just the way these hotel contracts work. And so let's say you want to have an event sometime during 2021 or even the beginning of 2022. Are you going to enter into a contract like that under these circumstances? We all know that there have been a number of super spreader events, not just the campaign rallies, but that wedding in Maine that we've heard about, other kinds of gatherings. And the real question, I think, is, can these organizations actually make commitments to hold meetings and hold social gatherings anytime in 2021 as a result of the way that the pandemic is evolving right now? I just don't know. I mean, even if the rules would allow it, are people going to feel comfortable going to those sorts of meetings and events anytime soon? Especially if what we said earlier about the vaccine is the case, that it probably won't really be rolled out till well into 2021. So there could be pretty slow going in certain sectors. Okay, well, we're getting to the end of our time. Does anybody else have any observations or questions? If not, we can wind it up and
Hey, David, this is Richard. I would love your commentary on the Senate. In particular, we hear Biden is saying that, let's say the Democrats win, but it's only like 52-48, that they would cancel the filibuster. And the implications of what that means, long term. And could you talk about that?
Go ahead, Jennifer.
Okay. I'll take that one. Well, I mean, that's a huge implication, needless to say, for canceling the filibuster. I mean, that's, Biden can say what he would like to do, but it would be up to, obviously, whoever is the majority leader at that point, and then the Senate at large, because it is, you know, a Senate rule to do so. And you are right about the implications as to what it means. And in some respects, even I'm a House rat. I was on the House side. So I'm constantly frustrated at the Senate and the lack of action sometimes when I was a House staffer, and still am sometimes. However, you know, the filibuster, despite its downside, it also has, you know, protected the United States in some respects, some would argue, from hasty actions. You know, and you see what has happened with, you know, the Democrats at one point, you know, judges were not being approved, the nominees of President Obama, so they eased the rules on the confirmation of judges. Well, that hasn't worked necessarily to the benefit of, you know, the minority in the Senate right now, with so many judges being approved quickly. And, you know, those appointments are pretty much for life. So I think, honestly, I think it's more of a messaging, more messaging than substance with regard to promoting getting rid of the filibuster.
Okay, thank you. Any other closing thoughts?
I'll just tell you guys one more thing, which is I do a lot of work with the Apache Software Foundation. As you guys know, several very large blue chip companies have put in travel bans for their employees through June of next year. So there won't be very many trade shows from several large corporations, which I can't name, but they also won't be attending any large trade shows. So.
Yeah. I guess it's also the case that, I may not have the number exactly right, but there's been some recent polls about who will be willing to get the vaccine. And apparently it's only about 50% of people say that they're willing, at this point anyway, to be anywhere among the first to take the vaccine. We're going to see how it goes.
Did you say 50 or 15?
50. Have I got that right? Maybe somebody knows the statistic better than I do.
I've heard something to 50 to 60 at the most.
50 to 60%. So that means
plus
that
CDC is lowering the efficacy requirement for the vaccine from the normal 70 to 50% as well. So that'll be 50% of 50%. So, you know, we'll only have 25% efficacy from that expected number, which is nowhere near the 70% herd immunity numbers that the epidemiologists keep saying we need to hit.
So even if the vaccine happens, and you know want to do normal socializing at trade shows and other events sometime during 2021, how comfortable are people going to be?
Especially with a potential efficacy level for the vaccine of just a few months. No, we need to be putting more time and effort into a viable treatment. A vaccine is absolutely a political illusory measure, in my opinion.
Hey, on that very note, hey, Nick, could you give us your 2 cents as a doc on what you're thinking about Moderna and the RNA vaccines versus the more traditional protein antibody vaccines in terms of efficacy, 1 shot versus 2, side effects?
Yes, Nick had to drop off and so he passed host duty over to me, and he apologizes. And I am absolutely, that's a great question, Richard, and I am unprepared to address it.
We talked about it a little bit at the outset of the call, Richard, maybe before you joined. And
yeah, I caught that, but I thought it's really so important to
okay.
maybe even at the we reserve the first few minutes of the next meeting because it's going to be so timely.
Yeah, I have a feeling we'll be talking about this issue at our next meeting. Okay, well, thanks very much to Deanne and to Angela and to Jennifer for your observations, and to everybody for your questions. In some of the chat, the questions were asked, are we going to post this on the website? The recording, as always, of the meeting will be posted. The slides, I guess, will be available by a link, right, Deanne?
Right. We can post the EHI link, which has the slides as well as the whole recording of Dean Rosen's webinar, but we can't post the slide file itself, just the link.
Okay.
And it's a great listen in terms of the banter between left and right. It's humorous. It's delightful to listen to.
Yeah, it's a really good event. So I'm glad they enabled us to talk about their slides.
Okay, great. Well, stay safe.
I will leave the Zoom meeting open after the call, but I will stop the recording now.
Okay, thanks to everybody. Have a good weekend.
Thanks.